Okay, so we have an order for 2.5 milligrams IV push every 4 hours as needed for pain. I did the drug problem and we get 0.6 milliliters and we're giving it over 4 to 5 minutes. I'm going to check my physician's order to my MAR and I'm looking for patient's name, dose, time, route. He has no known allergies. And then I'm gonna check my medication to my MAR. It is the right medication and it is not expired. So then I'm gonna go to my drug book, and 2 to 10 milligrams every 3 to 4 hours is a safe dose, so we have a safe dose. It says it may be given undiluted, but we're gonna dilute it since it's such a small dose with normal saline, and it's compatible with normal saline and D5W, which is what we have hanging up here. So we're gonna give 5 milliliters, so we're gonna give 1 milliliter every minute for 5 minutes. And then we're gonna monitor for respiratory depression and then reassess the pain level after we give the pain medicine. So now I'm gonna take my MAR to the med room and I'm gonna gather my equipment. Okay, then I'm gonna wash my hands. I'm going to clean both of these for 30 to 60 seconds. I have 0.6 milliliters of morphine, and now I'm going to dilute it with normal saline. Before I leave, I'm going to label my syringe with the name of the medication, the date, and the dose. Okay. Now I'm going to go to the patient's room. I'm going to take my MAR with me. So I'm going to identify my patient. I'm going to use name and date of birth, check it with the armband. Then I'm going to explain the procedure. You're getting morphine for your pain through IV push. I'm going to ask the patient if he has any allergies. He does not have any allergies. And I'm going to check and see if the line is still good. So I'm going to lower the bag. And it's still good. And then I'm going to check the IV site. There's no redness, swelling, or anything like that, so it still looks good. So now I'm ready to give the medicine, and I'm going to wash my hands. And then I'm going to clean and give it to the port closest to the patient. And clean this for 30 to 60 seconds. Okay, and so we're going to give 1 milliliter every minute for 5 minutes. So I'm gonna clamp this and then push 1. Okay. And I'm gonna unclamp. And then a minute's passed, so I'm gonna clamp this again, push another, and unclamp. Another minute's passed, so I'm gonna clamp again, push 1, and unclamp. Another minute's passed, I'm gonna clamp again, push another, then unclamp. Another minute's passed, so clamp again, and push the rest, then unclamp. So then I'm gonna discard. I'm gonna monitor my patient and reassess my patient and come back and check in 30 minutes to see how my patient's pain is. And then I'm gonna go document MMR, and I'm gonna document the patient's name, the dose, the time, the route, the patient's response, and I'm gonna sign.